Welcome back to another session with your psychiatrist, Dr. Nick Pejic, straight out of New Orleans, Louisiana, here at Atlas Psychiatry, where I give you the truth in psychiatry as I see it. Remember that this is not medical advice specifically for you, and if you have questions about your own mental health, please speak to your physician about it. Okay, so today we're talking about Spravato. Spravato is a new medication that was approved that patients self-administer through their noses for the treatment of major depression. This is, in fact, esketamine is the chemical name for the new medication, and it's a form of ketamine. So let's talk a little bit about that. Ketamine has been used for a long time in emergency rooms to help reset bones in adults and children and other procedures. It's often used with other anesthetics, but the doses in emergency room are much higher than we use in psychiatry. What they found along the way is that folks who had ketamine administered to them the ketamine had an antidepressant effect and an anti-suicidal effect. So their suicidality, the thoughts of not wanting to live anymore, would dissipate or go away entirely. And this was rapid. This is a lot different than the other medications we use in psychiatry, like antidepressants take sometimes 2 to 6 weeks to kick in, and transcranial magnetic stimulation, as well as electroconvulsive therapy, two other advanced therapies, take sometimes weeks to work as well. So in psychiatry, we really needed a medication that could work immediately as an antidepressant. Now, this is different than medicines like Xanax, Klonopin, or Ativan. Those medications can treat anxiety very quickly, but they're not really good at treating depression. And psychotherapy takes many weeks to work as well. So really this product was important that it came online. The controversy with ketamine initially was that anesthesiologists who don't practice in mental health were administering intravenous ketamine to folks who had very severe depression. But also that psychiatrists were administering ketamine intravenously throughout the country and the world. But they don't typically start IVs day to day, and it's just not in their wheelhouse. It was thought that it was safe enough though, because psychiatrists only use we use a lower dose of ketamine intravenously for the patients, where it doesn't knock them out. In fact, that the patient has a dissociative experience with a rapid antidepressant effect. So they're awake throughout the whole procedure, and it's kind of like a dreamlike state is what my patients explained to me. So the FDA and the state boards throughout the country had not approved ketamine for depression until Spravato was approved. So Spravato was approved in March 2019, in and around there. And it's different in that it's not an intravenous administration, but you insufflate it, which means that you put it in your nose and you snort it, or you take a light breath in. So this is ketamine right here, or this is the Spravato. It's a little device that you place in your nose, and you put one click. You put one click in, and then another click, and you wait 5 minutes, and you do that again in your left nostril. And what happens is over the next few minutes, patients start to go into that dreamlike state. They are awake. We are there with them on site, and we measure our patient's blood pressure during the event, because blood pressure can escalate a little bit. It takes about an hour for people to have for patients to have the full experience, but we were mandated to have them on site for 2 hours. So there's kind of a long process. Patients also cannot drive themselves home or operate any machinery for the rest of the day. It's usually recommended that they sleep that night, and then the next day that they can drive. So how often is this administered? For ketamine, or for Spravato, if somebody's very depressed and they want to do this treatment, we recommend that they do 2 treatments, each lasting 2 hours a week for 4 weeks. And then thereafter, we kind of sit with our patients and discuss what the treatment plan should be for them. The only downside to this type of treatment is that it's fleeting. So the antidepressant effect might last in the beginning 24 to 48 hours, and then they have to come back for another administration. What we hope is that this lasts a lot longer, so that patients maybe have to come back every once a month, let's say, for their treatment after they're in maintenance therapy. Otherwise, though, it works very well, and many of our patients have found it to be very helpful. They become more productive. I've had a patient tell me that after the treatment that he wanted to go walk his dog, and he hadn't wanted to do that for many, many months. And that was an indication that he had that goal-directed behavior and wanted to get back to his normal routine, which is fantastic to see that. So does it work? Yes, it does work. Astoundingly so compared to other medications that we have. And yet it's just more time-intensive for patients. Here at Atlas Psychiatry, we usually try to get patients well with psychotherapy and medication management. I love psychopharmacology and brain science. I describe myself more as a biological psychiatrist, in that we use medications and other treatments like transcranial magnetic stimulation or genetic testing to get people well. So it's nice to have another tool in the tool shed, so to speak. Let's see. If you are interested in ketamine, you can call our office, and we can do a benefits investigation for you to see if your insurance covers it. And I'll talk a little bit about that. So Spravato is a unique medication in that some insurance companies see it as a medication, kind of like you're going to get a prescription of Zoloft and you need a prior authorization. They often treat it like that, which is pretty straightforward process, where we call your insurance company and get it cleared. However, some insurance companies see it as a medical procedure of sorts, kind of like getting like an appendectomy, something like that. And that requires a longer process to get cleared for it. So we've had some red tape along the way with certain people's insurances, but other folks' insurances are fine. Other than that, we're lucky to have it in Louisiana now, and I'm glad that we can administer it for our patients. If you have any questions about this, feel free to, in the message box below, to message me or our clinic about it. And if you enjoyed this video and you find it helpful for you, your understanding about this new product, smash the like, hit the subscribe button, and ring the little bell so that you get all these updates when we have a new video out. Hope you're all doing well. I'll see you next time.